So, general anesthetics. So, today I'll be taking intravenous anesthetic, which are the faster or fast acting drugs. Um, so, these intravenous drugs, they are actually used for induction. Induction means just the starting. So, it is given as IV injection, within 11 seconds, it will reach brain and it will cause loss of consciousness. So that is called one arm brain circulation time. So when we inject within 11 seconds, so it is so faster. And so because of its rapidity of action, it is used for induction. And once it is in after induction, it will be maintained by the anesthesia will be maintained by other inhalational agent, and then we have to give some analgesics as well as muscle relaxant, because all in the inducing agent will not be having any analgesia. So in addition, we have to give analgesics as well as muscle relaxants. That is how the anesthesia is conducted. Then the first drug, it is the thiopentone sodium. It is the most important. It is the ultra short acting thiobarbiturates, and it is highly water soluble. And the important point is that it should be prepared freshly. Just before anesthesia, it should be prepared. It should not be kept for a long time. And another thing, when we are injecting, we have to be careful. There should not be any extravasation, that is bulging or something, because it may cause like this. It may cause intense pain, necrosis, gangrene, etc. can cause. So we have to be careful with thiopentone. So we have to be careful in injecting the drug, that is thiopentone sodium. And other features. So when usually in the dose of 3 to 5 milligram per kilogram as a 2.5% solution. So those who want to become an anesthetist, you should know the dose 3 to 5 milligram per kilogram as a 2.5% solution. And when we are injecting, the patient will be unconscious in 15 to 20 seconds. So you can see it in 15 to 20 seconds, he will be unconscious. So what is the route? So it is a highly lipid soluble drug. So so when we are injecting, it will be first enter the blood, then it will be going to brain, and immediately it will be entering the brain, because brain is also lipid. And from there also there will be distribution to muscle fat. So the blood concentration, it reduces. So from the brain, it back diffuses to blood. That is the first dose. And if you are not giving the second dose, then the consciousness will be regained in 6 to 10 minutes. So maximum 10 minutes only, its effect is there. But we have to give repeated injection so that the extracerebral sites are also filled up. Extra means other than brain, other sites are also filled up. So it causes unconsciousness, and after the surgery, after the procedure is over, the patient should not be allowed to leave the hospital without any supporting person, because he may because of the drowsiness he may fall. So we have to be very careful. Then about some other points about thiopentone sodium. It is a poor analgesia, so it is not having any analgesia. So along with that, we have to give opioids or nitrous oxide, and it is also a weak muscle relaxant and does not irritate air passages, but it can cause respiratory depression. BP also can fall due to vasodilation. So these are the important. So it is not it is a poor analgesic, poor muscle relaxant, but respiratory depression can cause BP also falls. So these are the points of thiopentone sodium. Then we will see some other uses of adverse effects. Adverse effects, laryngospasm. Laryngospasm, it is mainly because of some secretions that is happening when we are injecting. So if we give some atropine pre-medication, atropine, it is an anticholinergic drug, it will reduce the secretion. So if you are giving atropine, then we can prevent laryngospasm. And also for introducing this endotracheal intubation, during anesthesia, we will be putting the endotracheal tube. So for that, we have to give one muscle relaxant that is called succinylcholine. So if you pre-medicate with atropine and use succinylcholine, then there won't be any laryngospasm. Then some patients may develop shivering and delirium. Pain also can occur in the postoperative period because it is not an analgesic agent. Then one important adverse effect, it can cause acute intermittent porphyria in susceptible individuals. So this question, this is very important for university exam as well as for the PG entrance exam also. This is very important. The drug which the anesthetic which causes or which precipitate acute intermittent porphyria is thiopentone sodium. Please remember that in your future PG entrance examination also you can remember this. Okay, now coming to some other uses. So thiopentone sodium, it is used for anesthesia, that is induction, anesthesia induction we are using. Other uses, it is also used for the epilepsy, convulsion, control of convulsion, the narco-analysis of criminals, and also in psychiatry department. So narco-analysis means this is, suppose this is the criminal, in order to take all the truth, so it is taken as a truth serum. So the doctor will be injecting the thiopentone sodium, and he will, under the influence of this thiopentone sodium, he will be telling all the truth. So he cannot hide the lies. So it knocks off guarding. It is all the his defense mechanism to avoid telling lies that will be knocked off. So that is called narco analysis. So for the narco analysis of criminals, we are using this thiopentone sodium. It is some layman's talk. It is also called a truth serum. So it will take all the truth from within a person. Or even for psychiatry department, psychologists, they also use this. And in the department of this police department, also for the narco analysis of criminals, we are using this. Okay. Then another drug, that is the methotrexate sodium. Okay. Now propofol, second drug, third drug, it is propofol, and a very, very important. So it has superseded. That means instead of thiopentone, we are using, most of the people, they will be using propofol. It is used for induction as well as maintenance. And another thing, it is an oily liquid and it is available as emulsion. And for this emulsifying, some agents are used. So some patients may develop allergy to this emulsifier. So that is the one point about propofol. There may be allergic reaction. And like thiopentone, it is also causing unconsciousness in 15 to 45 seconds and lasts for 5 to 10 minutes. And it is distributed rapidly. So the drug is propofol. We will see some more features. How it is acting, it will be causing the CNS depression by enhancing GABA, GABA-A receptor-mediated neuronal inhibition. In the CNS interaction, we have seen all the inhibitory and excitatory neurotransmitters. So GABA-mediated neuronal inhibition is caused by propofol. Most of the anesthetists, it is caused like that, but there is some difference. I'll tell you that. Now coming to the important points, it is preferred in asthmatics because it won't produce any airway irritation. So it is preferred in asthmatics. So propofol, it is preferred in asthmatics, and also OP surgery. Some surgeries, for example, some small surgeries, excision of a ganglion or or sutures, or what else? Anything, lipoma, any small lipomas. If such OP surgeries are there, we can use this propofol, because after this anesthesia, the residual impairment, it is less marked. And if at all there is some adverse effect, it will be lasting only for a short time. So it is used for outpatient surgery. And patient acceptability is very good because of this less side effect. Patient acceptability, it is very good. So that is propofol. Some more points where it can also cause fall in BP because of the vasodilator. Most of the anesthetists, it causes, I think almost all anesthetists, anesthetic agents, these inducing agents, it causes vasodilatation. But there is an exception. I'll come to that. Propofol, it causes a fall in BP. And dose-dependent respiratory depression, even though it is not irritating to the respiratory area, it may cause, if the dose is increased, then it can cause respiratory depression. And it is one of the anesthetic agent in the sub-anesthetic dose. That means the dose that is used for anesthesia, if it is a particular level, if it is less than that, less than the anesthetic dose. It is used for the sedation of intubated patients. See, like this, in the intensive care unit, patients will be intubated. Such patients can be sedated using this propofol. So that was about propofol. Now, another drug that is called etomidate. Not much about etomidate. Then, so that I was talking about thiopentone sodium, ethoxytone sodium, propofol, and etomidate. They are all faster acting drug. Now coming to slower acting drug. We have seen benzodiazepine. It is a slower acting drug. We'll see what all features are there. Usually it is given for pre-anesthetic medication. Pre-anesthetic medication means that is before giving anesthesia, some 1 or 2 hours before giving anesthesia, the patient will be given certain drugs like atropine, benzodiazepine, so or any anti-emetic drug, etc. And they will be kept in the pre-op room, so pre-operative room, and that is called pre-anesthetic medication. And this benzodiazepine is usually used for pre-anesthetic medication. But it can be used for inducing, maintaining, and supplementing anesthesia as well as for conscious sedation. I'll come to conscious sedation in the last slide. So that is, but the important points, they are poor analgesic. It is not an analgesic agent, benzodiazepine, and it won't markedly depress the respiration. But it is a centrally acting skeletal muscle relaxant. So it decreases the muscle tone by central action. So there is some amount of skeletal muscle relaxation is there. It is centrally acting, but it is not a analgesic. It is poor analgesic. Now, coming to these drugs are actually this diazepam or the benzodiazepine. These are the drugs used for small interventions. It is like endoscopy. Endoscopy, like this endoscopy. Then cardiac catheterization. You know that. Angiography. You know that. Conscious sedation during a local or regional anesthesia. I'll come to that. Then fracture setting. If there is some fracture, for setting the fracture, applying this cast, etc. So for sedating the patient, we can use benzodiazepine. And electroconvulsive therapy, there's a shock treatment in psychiatry. So for this short interventions, we can use this benzodiazepine. And if at all there is some, you want to reverse the anesthetic action, we can use the benzodiazepine antagonist, that is flumazenil. Okay. Now we will see some of the this one, benzodiazepine, diazepam. Diazepam, if you are giving directly into the vein, it may cause thrombophlebitis. So this is like this, there is inflammation of the vein. So it will cause the trauma to the vein and it causes inflammation. Usually this diazepam, it is given in a drip, IV drip. So this will reduce the burning sensation as well as incidence of thrombophlebitis. You should not give directly into the vein, but through a drip. So that is one benzodiazepine. Another benzodiazepine, it is lorazepam. Lorazepam, it is more potent than diazepam. And also, I told you that diazepam should be given in an IV drip, but lorazepam, it is not irritable or it won't cause any thrombophlebitis. It can be directly, it can be given. But if you want, you can give in the IV drip also, but it is not irritating. And both this diazepam and lorazepam, it can cause amnesia. Amnesia means memory loss. Then third benzodiazepine, it is midazolam. So it is very, very important. It is again, important points are it is water soluble, non-irritating to veins, and faster and shorter acting. And it is 3 times more potent than diazepam. So it is non-irritating. So no need of any IV drip, faster and shorter acting, and 3 times more potent than diazepam. So it is preferred over diazepam for anesthetic use. And because of its, it is faster acting, shorter acting, it is used for so it is the only suitable benzodiazepine for sedation of intubated and mechanically ventilated patients. So we have already seen a propofol that is used for sedation, but this is the only benzodiazepine. Which is the only diazepine? That is benzodiazepine. It is a midazolam. Midazolam is the only benzodiazepine suitable for sedation of intubated and mechanically ventilated patients. So that was about benzodiazepine. So three diazepines, benzodiazepine, we have seen diazepam, lorazepam, and midazolam. Midazolam is the one that is used for the sedation of intubated and mechanically ventilated patients. Now, next drug, it is ketamine. Ketamine, it is pharmacologically, it is related to hallucinogen phencyclidine. Phencyclidine. So one important point is that it causes dissociative anesthesia. So the anesthetic agent that causes dissociative, this is very important, dissociative anesthesia, it is ketamine. Ketamine is a very good anesthetic agent, and the patient, when we are giving anesthesia, he will be dissociated from his body and surroundings. So this example, this patient is not anesthetized. I'm just having for giving an example I'm telling. So this is the patient, and she is dissociated. So she will be dissociated from his body and surroundings. So when we are giving anesthesia to the patient, there is a formation of dissociative anesthesia. So that is, so the ketamine causes dissociative anesthesia. So don't forget, dissociative anesthesia is caused by ketamine. How it causes, what is the mechanism of action? So the other drug I was telling, it is through GABA, but this is inhibiting the excitatory amino acid, that is NMDA. NMDA type of excitatory amino acid receptors. So NMDA receptor antagonist. So that is this ketamine. And what are the features? So there is a very important, very good drug. Respiration is not depressed. Bronchi will be dilated. So it is useful in bronchial asthma. Airway reflexes are maintained. Muscle tone increases. Understood? So there is no depression of respiration. There is actually bronchial dilatation. Airway reflexes are maintained. Muscle tone increases. So this is the ketamine. But one very important point about ketamine is that it increases the heart rate, cardiac output, and BP because of the sympathetic stimulation. I was telling all other drugs, it reduces BP and because of the vasodilatation, but this ketamine, it causes sympathetic stimulation and increases the heart rate, cardiac output, and increases the BP. And it is not painful also, injection. So ketamine, it causes dissociative anesthesia, and it is a bronchodilator, and it causes sympathetic stimulation. So because of the sympathetic stimulation, ketamine can be dangerous for hypertensive patients, ischemic heart disease, because it increases the cardiac work, congestive cardiac failure, those with raised intracranial pressure, because it increases the cerebral blood flow and oxygen consumption. So ketamine we cannot use for these conditions because of the sympathetic stimulation. But for other cases, it is a very good drug, and even for hypovolemic patient, because it increases the BP, it is a very good drug. Hypovolemia, for example, some road traffic accident, loss of blood loss, there will be hypovolemia. Such cases, if these conditions are not there, we can use ketamine straight away. And this ketamine, it is one of the drug that is used for a rape drug. So when it causes what is it? It is used in many rave parties. So the girls will be given this ketamine. So it is not in the anesthetic dose, sub-anesthetic dose, and so the girl will not be knowing anything. So it is used for rape, as a rape drug. So it is ketamine. The next drug, it is fentanyl. Fentanyl. It is highly lipophilic. So, and it is an opioid analgesic. So fentanyl, it is an opioid analgesic. It is related to pethidine. And it is used for balanced anesthesia. That means along with other anesthetic agent, it is used. Then, like benzodiazepine, combined with benzodiazepine, it can be used for short procedures. I have told benzodiazepine, it is used for endoscopy, angiography, and minor procedures, etc. Burn dressing. So such cases, along with benzodiazepine, we can use fentanyl. Fentanyl, it is an opioid analgesic. So benzodiazepine, we have seen it is not an analgesic. So along with benzodiazepine, if we give fentanyl, then the patient will be getting analgesia also. But fentanyl, there will be one point. It is a dreadful recall. A dreadful recall means once the anesthesia is over, once the surgery is over, when the patient is recovered, he will be having the recall of all the events that happened during this when he was under anesthesia. So that is a very dreadful condition. So whatever they were doing, even though he was not sensing it, but he will be having the recall of all the things that happened during this surgery or anesthesia. So that is called dreadful recall. So that is happening with fentanyl. So fentanyl, it is an opioid analgesic, fentanyl. Then some more points. Fentanyl can cause, because it is an opioid analgesic, it can cause respiratory depression. Then the tone of the muscles, that is chest muscles and masseter, that is face muscles, it will be increased. Then heart rate decreases, and BP also it will fall because it stimulates vagus. So the only drug that increases BP, it is actually ketamine. So fentanyl also causes BP fall. Then fentanyl, because it is an opioid analgesic, we can use opioid antagonist if it is for much respiratory depression or mental clouding. If it happens, we can use the opioid antagonist like naloxone. So it is called it is the opioid antagonist. So that is about fentanyl. So fentanyl, main thing, it is a opioid analgesic. A dreadful recall of the anesthesia, it will be there, and there will be respiratory depression, and its antagonist, it is naloxone. Another congener of fentanyl, it is remifentanil. Remifentanil, it is having very brief action. Why? Because of the rapid metabolism, because the plasma and tissue esterases. Plasma esterases, you would have studied in the general pharmacology, there is in the early chapters, plasma and tissue esterases. So it is metabolized by plasma and tissue esterases. So remifentanil is having very brief action. So it is a congener of fentanyl, another opioid analgesic. For short painful procedures, we can use this remifentanil. It is very brief action. Remifentanil. Then another drug, it is dexmedetomidine. Dexmedetomidine, when you were learning this antihypertensive, you have already seen clonidine. Clonidine, it is a centrally acting sympathoglytic drug. It was acting on alpha-2 agonistic action. Similar to clonidine, dexmedetomidine, there is a drug called medetomidine. Medetomidine, it is a centrally acting alpha-2 agonistic drug. So it is the active enantiomer of medetomidine. It is dexmedetomidine. So that means dexmedetomidine, it is acting through alpha-2A. So similar to clonidine. This is another drug for sedating critically and ill ventilated patients in the intensive care units. So then side effects, because it is similar to clonidine, it can cause side effects like clonidine. It can cause hypotension, bradycardia, dry mouth. So clonidine, it doesn't, you know that it is an antihypertensive agent. So like that, dexmedetomidine, it can cause hypotension, bradycardia, and dry mouth. So that is dexmedetomidine. Now I was talking about conscious sedation. So this diazepam, fentanyl, etc., it can be used for conscious sedation. Sedation. So what is this conscious sedation? First, we will read this sentence, then I'll explain. In conscious sedation, drugs are used to produce a state of CNS depression, but not unconsciousness, sufficient to withstand the trespass of the procedure while maintaining communication with the patient, who at the same time responds to commands and is able to maintain a patent airway. So for short procedures, for example, some dental procedures like RCT or something, small procedures, these drugs will be given. So it causes a CNS depression, and the patient will not feel the pain or anything. And at the same time, she will be or he will be awake. And the doctor can communicate with the patient, but at the same time, she or he won't be knowing feel the procedures. So And another thing, we can maintain the patent. We don't need any intubation. The patent airway will be there. Patient will be breathing by his own this thing. So that is so just a sedation. It's a drowsy feeling only. So that is called conscious sedation. Understood? So they are used to produce a state of CNS depression. They withstand the trespass of the procedure, but we can communicate with the patient and we can maintain the patent airway. So this is called conscious sedation. And what are the drugs? Drugs used are, we already seen for small procedures like short procedures like diazepam, midazolam, nitrous oxide, dexmedetomidine, fentanyl, etc. So we'll just have a look once again. Just go through this thing. Important points only I'll show. So 11. So there will be one arm brain circulation. It is 11 seconds. Thiopentone. It can be if it is extravasation can cause gangrene. Then yes, it is a poor analgesic and it is a poor muscle relaxant. BP fall can occur. Then it can cause laryngospasm, and thiopentone, it causes acute intermittent porphyria. Then it is used for narcoanalysis and also for convulsion. So that is the thiopentone sodium. Propofol, because of the emulsifier, there may be allergic reaction. And it is used for it is preferred in asthmatics as well as OP surgery. And also is used for sedation of the patients in the intensive care unit. Then now slower acting benzodiazepine. They are poor analgesics, do not depress respiration, and is used for conscious sedation. And it is used for short procedures. And the antagonist, it is flumazenil. Diazepam, we have to give in IV drip because it may cause thrombophlebitis. Lorazepam, less irritating. Midazolam, it is again very faster acting as well as shorter acting. It is not at all irritating to the veins, and it is one of the drug for sedation of the intubated ventilator. So propofol, midazolam, these are used for. Then ketamine, so it causes dissociative anesthesia, and but it increases the BP because of the sympathetic stimulation. Ketamine can be dangerous in all these conditions, but it is good for hypovolemic patients, and it is used as a rate drug. Fentanyl, it is an opioid analgesic, but there will be dreadful recall, and it can cause respiratory depression. The antagonist, it is naloxone. Remifentanil, another congener of fentanyl, and it is very brief action because of the rapid metabolism by plasma and tissue esterases. Dexmedetomidine, it is like clonidine, it is a selective alpha-2 agonistic drug. And it's like clonidine, it can cause side effects. And conscious sedation, when the drug is injected, there will be CNS depression, but the patient will be responding or communicating with the doctor can communicate with the patient, and he won't feel the trespass of we can withstand the trespass of the procedure, and we can maintain a patent airway. And the drugs that are used for conscious sedation, it is diazepam, midazolam, nitrous oxide, it is an inhalation agent, dexmedetomidine, and fentanyl. Yes. Okay, I think that was the last slide.